Good morning, I'm Dr. Brad Spiegel. I'm a pain management specialist here, and I'd like to talk today about two different types of pain, acute and chronic pain. Acute pain, actually, even though you might not know the words, everybody knows it. Acute pain is a pain that reflects a tissue damage, and we all know it because if we cut our finger, if we hit our finger with a hammer, an incision from surgery, labor pain, all these have some form of tissue damage, and that's why you get the pain. The actual pain you're feeling, or the degree of pain, is relative or in proportion to the amount of tissue damage. Acute pain is usually limited by time, so usually it heals. Usually within 3 months. It could be up to 6 months. But that's the main difference between acute and chronic pain. If the acute pain continues, it could go to the point of becoming chronic pain. And there's a big difference in chronic pain versus acute pain. Acute pain truly has a purpose. It prevents us from doing bad things. You remember that you hit your finger with a hammer. You have a broken arm, and as it's healing, you're not using the arm, so it's healing. Chronic pain has no biological function. It actually just impairs your life. It actually can destroy your life. It makes it to the point where you can't function. You can't do your daily chores or enjoy life. With chronic pain, very often there may not even be a source of the pain that's obvious. There's two different types of chronic pain. One would be, as I mentioned, the pain that has a perceivable pain generator or a source. An example of this would be a lumbar disc disease, spinal stenosis, something that is compressing for long periods of time and it's creating chronic pain. The other type of chronic pain would be a pain that does not have a perceivable pain generator. For example, fibromyalgia, failed back syndrome after a long period of time when it's already healed, lower back pain without a true source that's identifiable. These pains are persistent, they're debilitating. The actual pathology has created a pain cycle or a pain path up to the brain, and it fires or misfires when you don't want it, or all day possibly. This pain is not easily treated in the usual manner with just plain narcotics. In the old days, chronic pain was just treated, they ignored it. Today, what we do is we try and approach it first of all with pain medication if we need to. We need to change the pattern of the patient's life. With this, we add not only nutritional support, acupuncture, biofeedback, meditation, praying. All these help the patient deal with the pain. Very often they can't get rid of the pain completely, but if you can get rid of a portion of the pain, they regained so much a part of their life. A lot of it has to do with perception, what you perceive in the room or in your body. An example was given once by a physician that you're in a room with an air conditioner. You hear the air conditioner, but the majority of people, it doesn't bother them. Some people can't not focus on the air conditioning, and they hear it all day long, and they don't function. You can't get your job done. So with a multidisciplinary approach, with all the other ways, just not with pain pills, you can treat these patients with chronic pain. Sometimes we'll have to do interventional procedures, injections, and that may help. But with these, you can reduce the pain, hopefully eliminate the pain, and let them regain their life.